Welcome, my dear friends. Myself, Professor Dr. Rajendra Raghuveer Deshpande from Pune, Maharashtra State, India, would like to welcome you all in my Ayurveda Academy YouTube channel. As you know, Dr. Deshpande, that means myself, is MD in Ayurvedic medicine, that is Kaya Chikitsa, and MD in Ayurvedic physiology. For paid online consultation, I have the excellent team of doctors, so you can definitely only WhatsApp, please. 9226810630. The number is given in the description. My dear friends, today's topic is a part of that I am making the serial Ayurveda in GP, Ayurveda for General Medical Practitioner. And today's topic is very, very interesting because each and everybody on this earth is suffering at any of the time in his life about fever. In the medical language, it is called as a pyrexia, Pyrexa. And in Ayurveda, it is called as a ज्वर व्याधि, बुखार बोलते हैं ना हिंदी में. तो मेरे प्यारे दोस्त, my dear friends, actually the fever is a very, very big, what you can say, the disease to be discussed, because there are hundreds of causes of the fevers, and I am discussing the causes as well as the, what you can say, the investigations, and then we are talking about the Ayurvedic treatment. So I am extremely sorry, my dear friend, but keep patience to see this video till end, because this video may be little bit longer because the topic is such an interesting topic and very important topic in our life. Fever, jvara, is according to Ayurveda is basically the pitta disorder. And also it is a rasa vaha srotas problem. Rasa vaha srotas, rasa dhatu is the first part after primary digestion, and when it is faulty, that ama is generated. Ama is like a toxin-like substance, and that creates the problem in our srotorodha, and then the body temperature increases. Jvara pratyatma niyata lakshan, that means the specific feature of jvara is santap sharira manasaha. There will be irritation or the temperature raised of physical level as well as the psychological level. That's why there is a little bit irritation of the mind whenever the person suffers, even from the viral fever. The commonest fever in our general medical practice is, of course, the viral fever. But latest, you have experienced the coronavirus, and there also you get a lot of problem with the fever and breathlessness and this and that. And you also know the little bit different types of fever, like for example, typhoid, malaria, this and that, tuberculosis. So there are a lot of causes. I'm going to tell you the each and every thing about the causes, investigations, but I'm not going to discuss detailed about typhoid. I'm not just going to discuss detail about the tuberculosis. I'm not going to discuss detail about malaria, my dear friends. But all these separate videos, total separate video on typhoid, separate video for the dengue, separate video for the malaria, separate video for the tuberculosis, yellow fever, chickenpox, measles, all these videos are available on my YouTube channel, scientifically and very lucid language. Like Dr. Deshpande has a knack, by God's grace, to teach any topic in a very simple manner. So let us start to discuss about fever. So first we will discuss about causes. Number one, acute exanthema or eruptive fevers. When there is a skin rash, it's called as eruption, skin rash. Chickenpox, the rash will be on the first day. In the measles, the common problem in the children, fourth day, the measles skin problem will start. Erysipelas on the second day, the rash will come. Rubella, first to fourth day, any day, that particular skin rash will come. Typhoid fever, 8th to 10th day, that particular rash may come. Scarlet fever, second day, the rash will come. Now, group 2, occasionally present early rashes. It's not mandatory. It's not every time. Dengue cases, sometimes the rash will be there on the first day. Classical typhus from 4th to 5th day. Anthrax, acute glandular fever. These are not the common fevers. Group 3, yes, tuberculosis is very common. Everybody knows Mycobacterium tubercle. When your immunity goes down, you get the droplet infection by any person in the crowd. So typhoid can be prevented by avoiding to the crowded places. Then malignant disease, especially of the kidney or the bronchus, it can cause the fever. Typhoid or paratyphoid fever. Sepsis, that means abscess originating from the appendix or gallbladder, genitourinary tract, alimentary canal, that is digestive system, and empyema, lungs. Then subacute bacterial, this is a heart disease, endocarditis, urinary tract infection, very common. Whenever you get the infection, please think of the urinary tract infection, also malaria. The typical feature of malaria and UTI is fever with rigor. Fever with rigor, like this. Tremors, rigors. Fever with rigor, two main causes. One is urinary tract infection, pus cells in the urine, or malaria. Remember, fever with chill is common. A simple, small eruption is common, but fever with rigor, this is uncommon, and it is indicating malaria or the urinary tract infection. Can you see 6 and 7? Fever with rigor, urinary tract infection, malaria. Then glandular fever, syphilis, brucellosis, Hodgkin disease, some rare possibility. Then polyarteritis nodosa, also rare. AIDS, yes, it is common. Then common causes of fever seen in the GP. These are the most important 12 causes. For example, flu, most common, or influenza, cold or upper respiratory tract infection like tonsillitis, laryngitis, bronchitis, pneumonitis, okay? Infective hepatitis, very common, jaundice. Then pneumonia, here you will get the liver tenderness in jaundice because of the contaminated water. Then pneumonia, infection in the lungs, then there will be lot of breathlessness, and immediately you do the X-ray, you will get the result that the patient is having either pneumonia or pleurisy. Pleurisy is a fluid in the parietal or the visceral pleura coverings of the lungs, and that is mostly because of the tuberculosis. So pleurisy is mostly tuberculosis. Then amoebic hepatitis, amoebic infection, actually it is in the intestine, but it reaches to the liver, and that is called the amoebic hepatitis. Then meningitis, very serious disease. You must diagnose meningitis perfectly and send that particular child or the adult to the hospital. No treatment is possible in the general medical practice. Meningitis patient should inflammation of the coverings of the brain, that is called as a meningitis. High fever, projectile vomiting, neck stiffness, and the Babin skin sign is positive. So all the details are there in the separate video of the meningitis. Typhoid fever, actually the diagnosis of typhoid fever is done in the second week. If you don't give any antibiotic for the first week, then the typhoid test of Vidal will be positive. But nowadays there is no waiting or the patience in the patient as well as in the doctors. They start the antibiotic immediately after the first or second day. That's a problem. Actually, viral fever needs no antibiotic because antiviral is of no not necessary. Basically, resolves automatically. Only you have to give the symptomatic treatment, that is antipyretic, reducing the fever. That is called as a diaphoretic, which will increase the sweating. Okay. Next will be the infectious fevers like chickenpox and measles. Yes, they are common in the children. Pielitis, that urinary bladder has inflammation and infection. Malaria and tuberculosis. Now let us talk about the hemogram and ESR to rule out the acute or chronic infection. So how? We don't understand. Simple thing. WBC count. Look for the WBC count. White blood cell. They are the soldiers of our body. Normal count is 4 to 11,000 per cubic mm. If the 10,000, it is a 15,000 mild infection, 25,000 moderate infection, more than 25,000 per cubic mm white blood cell. Oh my OMG, severe infection. That can give the idea about infection. Then also immature cell indicate the blood cancer, leukemia for premature cells or abnormal cells. PBS, peripheral blood smear of the blood on the glass plate, that see the under microscope, then you can get the malarial parasites for evidence. Then there is a typical cells, white blood cells are called as a eosinophils. If that normal count is 0 to 5 in 100, 5%. If they are more than 10%, then it is called as a eosinophilia. Non-stopping of the cough for more than 3 weeks. If you are giving Sitopaladi Churna, Talisadi Churna, this and that, Drakshas, so whatever you want, but even the modern azithromycin, and the cough is not responding, there is possibility that your cough is allergic or the tropical eosinophilia is the name. Eosinophil counts are raised. Okay. Then specific tablet hetrazan. In modern medicine, it is given. In Ayurveda, we always recommend some Sanjivani Vati or Chitraka Valeha or Bhalla Takaso. Urine routine to rule out the urinary tract infection, and also it can show the bile salt and bile pigment in the urine, which is very cheap investigation that can indicate you the jaundice. For the quantitative, what you can say, the getting judgment of this jaundice, you can do the serum bilirubin test. Okay. Then stool routine for ova or cyst, amoebiasis, or giardiasis or roundworm, threadworm, hookworm, tapeworm, everything can be detected by stool examination. Then X-ray test, very common to detect the tuberculosis, pleurisy or pneumonia. Vidal test on the 9th or 10th day of the fever to rule out the typhoid. Titer will be raised, but if you have not used any antibiotic in the first week. But this is nowadays very impossible, and so Vidal test can't come positive. Okay, you have to wait for second. I am not saying that you get in a serious, what you can say, the stage, but only symptomatically you can control the fever. And if it is not controlling in the 1 week, then in the second week, yes, Vidal test can be done and it will be positive for typhoid. CSF examination, cerebrospinal fluid regarding the brain to rule out the meningitis. Now we will see the different treatments, Ayurvedic management for different diseases. For example, fever due to influenza or the flu, you can use the Tribhuvana Kirti Fort. TK is a Tribhuvana Kirti Vata Kafaja Jvara. 2 tablets 3 times in a day. Then Jvarankusha Rasa. HP means Hari Parshuram Aushadhalay. It is an Ayurvedic pharmacy from great Khadiwale, late Khadiwale Vaidya sir, who was also my guru in the Pune city, Maharashtra state, India. So you can search on the internet, Jvarankusha Rasa, 2 tablets 3 times in a day with ginger juice, Amapachak, Sitopaladi Churna for cough, because CCF is a feature of flu, cold cough fever, CCF, Sitopaladi Churna, 2 tablets 3 times in a day, which reduce the pharyngitis, laryngitis, etc. Then, in spite of that prescription, you can use Nagaguti, is very, very hot. Kafagna, Nagaguti, Ayurveda Rasashala Pune is available, 1 tablet 3 times in a day, and Prajaktaguti from Parijat, herbal plant, Prajaktaguti, Ayurveda Rasashala Pune, 2 tablets 3 times in a day. Okay, next, another prescription, lot of prescriptions Dr. Deshpande is providing for your intelligence. You can use the proper medicine at proper time. Flu 5, Ayurveda Seva Sangh Nashik, 3 tablets 3 times in a day. Curil tablet from Charak Pharma, very famous, 2 tablets 3 times in a day. And Penex to control the body ache and what you can say, the severe headache. You can give the Penex, Charak Pharmaceutical, 2 tablets 3 times in a day. Another prescription for flu only, Tribhuvana Kirti, 2 tablets 3 times in a day, or Jvara Gna Kadha from 4 teaspoons with equal amount of water after meal. The next prescription, I think I personally like, just wait. Let me mark. This is the most favorite tablet of mine. Most favorite. Maha Sudarshana Ganavati is always available at my home. Always available with my family, with my brothers, with my sisters, with my family members, because this is the best Ayurvedic medicine to give the symptomatic relief in any fever. You can use this tablet in any fever just to control the fever, because it is bitter in taste and it is a diaphoretic. It gives you the sweating, and automatically the fever will temporarily come down. In the flu, it will be automatic. Flu will also go, because this is Amapachak also. But Mahasudarshan Ganavati should be in everybody's house, like you keep the Crocin strip, Crocin 500, Crocin 650, tablet Dolo. Yes, you are keeping that. So in spite of that, I will recommend you keep Ayurvedic Mahasudarshan Ganavati from Baidyanath company, 60 tablet always at your home. Then there is a Lakshmi Vilas Ras, Baidyanath company, 1 tablet 3 times in a day with Tulasi juice. Tulsi plant is very good for this flu. Okay, everybody knows that. Even the Red Label company has formed a medicated tea also, that with the different plants. Now, another mixture that is called as a Agua mixture, that is 4 teaspoons with equal amount of water 2 times in a day after meals. Then Ananda Bhairava Kas is a specific formulation, that 2 tablets 3 times in a day. Ayurveda Arkashala, this is Ayurveda Arkashala Satara. This is Ayurveda Arkashala Satara, Maharashtra state, India. Okay, I have taken the very, very useful products from the different companies. If fever is very, very high, cold water sponging, very essential, every 5 minutes, and external application of sandalwood paste on the forehead. Chandrakala Ras, very thanda thanda cool cool, Pittagna, Laghu Suta Shekhar, 1/2 tablet every half an hour. This is Ayurvedic emergency management. Then Kamdudha 250 milligram plus Praval Basma 250 milligram with Godanti Mishrana 100 milligram every 3 hourly till the temperature comes down. Then you need not to go to the hospital or take the injections. Okay. Then next is a Lakshmi Narayana Rasa 60 milligram plus Suvarna Suta Shekhar Rasa 60 milligram, more powerful. Then Mrugashranga Basma 200 milligram for the lungs and heart every 3 hourly. Then Gorochanadi Gutika, severe Pitta Shamak, is having the Shita Virya and it controls the heat of the body, one tablet every 2 hourly. Now, fever due to the cold or upper respiratory tract infection, same treatment that is mentioned just now. I have given you the 5 minutes different formulation, so use any of that formulation. Now we will go further. Pneumonia is a pneumonitis, inflammation of the parenchyma cells of the lungs. Okay, so treat as a fever due to the same prescription you can use, but some strong medicines we have to use to reduce the kapha in the lungs. That is Rasa Sindura 30 milligram, Abhraka Basma 125 milligram, Shrunga Basma 250 milligram, Praval Basma 250 milligram, Sitopaladi Churna 500 milligram. Together, make a mixture, and 3 times in a day, this mixture should be given with honey. Shahad, honey, is the best anupan or the carrier. It's a catalyst. It gives the action very quickly. Another prescription, Lakshmi Vilas Guti. This is separate and this is separate. Lakshmi Vilas Guti to 125 milligram. I will mark for your concentration over here so that you can concentrate on. Then Chandraputi Pravala Basma 125 milligram, Yashti Madhu 500 milligram every 4 hourly, because pneumonia is a serious disease. Many of the times it is admitted in the hospital also. So you can continue in the Ayurvedic hospital this treatment under the supervision of doctor. Guduchi 500 milligram is the best immunomodulator. Vasa 3 leaves plus powder of the Bibhitaki 1 gram, Punarnava 500 milligram. This is a diuretic and reduces the congestion in the lungs. Then the Kantakari is also bronchodilator 500 milligram. Prepare the decoction of all these things and add the sugar candy, and every 3 hourly you can give this fresh decoction. Okay. Now next we will go further. Another prescription, my dear friends, for pneumonia. Let us see what is that prescription. Kumar, especially for the children, Kumara Kalyana Rasa, 1 tablet 2 times in a day, plus Mahasudarshana Ghanavati, 2 tablets 3 times in a day. Crush it and make it a mixture in honey and give the chartan, especially if the child is around 10 years of old. Next, we will talk about the fever due to pleurisy. Now, what is that pleurisy? I have already mentioned water in the pleural cavity, parietal and visceral pleura, are the coverings are around the lungs. So treat as a flu, but give some additional treatment. Arogya Vardhini Vati, 2 tablets 3 times in a day with Tulasi juice. Arogya Vardhini is the best, what you can say, the tonic for the liver. And you know the liver is the biggest industry in our body. So whenever there is any chronic illness, automatically either protein metabolism, carbohydrate metabolism, fat metabolism, they are disturbed. Your vitamins and minerals, they also suffer. So to control the liver activity, Arogya Vardhini is the best medicine. Then Laghumalini Vasant, 2 tablets 3 times in a day with Tulasi juice. Then Nagaradi Kashaya from Hari Parshuram Aushadhalaya, which is a pharmacy from late Khadiwale Vaidya from Pune city, Maharashtra state, India. 4 teaspoons with equal amount of water 2 times after meals. Now let us go for the another prescription for the pleurisy. So my dear friend, this is for the pleurisy. Vaikranta Basma, very costly. But when the chronic and recurrent or resistant tuberculosis, then you definitely should use the Vaikranta Basma. Very little, 15 milligram. Rasa Sindur to reduce the kapha congestion, 50 milligram. Abhraka Basma to regenerate the damaged cells, 100 milligram 1 time in the morning with the milk. Then Tribhuvana Kirti, 2 tablets 3 times in a day. Shrunga Basma, 250 milligram plus Sitopaladi Churna for cough, 500 milligram 3 times in a day. Gandhaka Dhriti, the best antibiotic in Ayurveda. Gandhaka is a sulfur. Gandhak Dhriti, 2 drops 2 times with milk. This is very potent antibiotic type medicine in the Ayurveda. Now we will go further. Here just one is added. Kumar Yaso number 1, again for the liver, 4 teaspoons with equal amount of water 2 times in a day after meal. Now my dear friends, we are continuing the talk about the pleurisy, fluid in the lungs. That is mostly because of the tuberculosis. You can diagnose it by the X-ray. But the typical feature of the pleurisy, when the patient asks the patient to take a deep breath, immediately he will get a lightening pain, serious pain on that right or the left side where there is a pleurisy. Are you getting my point? And when the doctor puts the stethoscope, basically it is on the lower lobe. On the lower lobe, he will get the pleural rub. The doctor can hear the pleural rub like a friction sound. Okay. So here you can use the Panchasuta, 1 tablet 3 times in a day. Then Mrugashranga Bhasma, 250 milligram 3 times in a day. Gandhak Dhriti, or if not possible, Gandhak Rasayan tablet is also used. 2 drops 2 times in a day. Gandhak Rasayan tablet 2 times, 2 tablet 3 times in a day. Then Malla Sindhu, very strong medicine, but should be all these mineral preparations. I personally feel that Baidyanath company, I am satisfied with the Baidyanath company's results and also the quality basically, because all these metal purification should be very, very good. Otherwise, if newly coming pharmaceutical company, they are giving some metals, then little bit cautious should be there. Malla Sindur, 1 tablet 3 times in a day, or it can be in a powder form. So 500 milligram you can take. Then Arogya Vardhini, 2 tablets 3 times in a day, with also best metabolic stimulator, best rasayana for the liver. Kumar Yaso number 1, 4 teaspoon with equal amount of water, 2 times in a day after meals. Let us go further. If necessary, when the fluid is too much fluid in the pleurisy, then pleural tapping, putting the needle and taking out the fluid, is also done by a specialist, that is a chest specialist doctor, and then treatment can be given internally also. Now we are talking about a tuberculosis, TB of the lungs. Of course, TB can affect to any of the body, but specifically here we are talking TB of the lungs. Basically, 2 or 3 important symptoms I would like to repeat. One is a weight loss. Patient do not like to eat. For last 5-6 months, the patient is saying that I have lost my desire to eat, that is anorexia, and so I have lose weight also. Nearly 4-5 kgs in the last 2-3 months I have lost the weight. Oh, be cautious. Then intermittently I also get the cough. That is 3 important features: cough, then the fever, especially evening rise of temperature. This is typical in tuberculosis. Then the anorexia and the weight loss. So Laghumalini Vasant, you can diagnose by the sputum test also. You have to take the sputum for 3 consecutive days. Sputum examination for AFB, acid fast bacilli. So here you can give Laghumalini Vasant, 4 tablets 3 times in a day. Then Lakshmi Narayan Rus, 2 tablets 3 times in a day. Suvarnamalini Vasant, 1/2 tablet 3 times in a day in a chronic cases or resistant cases. Then here you can see the Tausashta Pimpadi Churna, 60 milligram plus Abrak Basma to regenerate the damaged lung tissue, that is cavity. Recovery is possible with the Abrak Basma, 60 milligram. Yashti Madhu Churna is also Ropurna, that is healing properties there, 125 milligram plus Shrunga Basma, best tonic for the lungs and heart, 250 milligram. This powder, this mixture has to be given 3 times in a day. Now we are discussing about the tuberculosis. So my dear friends, let me tell you the another prescription, the second prescription for TB. Vaikrant or Suvarna Bhasma, 15 milligram once in the morning with honey and ghee. Vasanta Kusumakara Rasa, 1 tablet 3 times in a day. Praval Bhasma, 250 plus Sitopaladi Churna, 500, 4 times in a day with ghee. Mauktika Bhasma, pearl, 50 to 100 milligram 3 times in a day. And Raupya Bhasma, 125 milligram 3 times in a day. Another prescription for the tuberculosis. Certina tablet from Charak company, 2 tablets 3 times in a day. Then Ojus tablet, 2 tablespoon liquid or 2 tablets 3 times in a day. And then Kalyana Sundar Ras Suvarna Yukta, 1 tablet 3 times in a day we can take. In addition, we have to follow this Pathya. Strict bed rest or the adequate rest, regular and wholesome diet, especially the proteins, milk and legumes, amla, green gram, munga dal. Grapes, garlic, eggs are good. Fresh air and morning sun salutation is also useful. Avoid the smoking, dust, damp, crowded places. Regular examination by a consultant is very essential. Now we will discuss about the fever due to the jaundice or infective hepatitis. So this is my first prescription. Arogya Vardhini number 1. I have made the research with Dr. Srikant Wagh in Pune city in Ayurveda what you can say, Nanal Hospital on the Karve Road, Pune, nearly 40 years back, and I have published that particular paper. We have made two groups. One is treated with the normal allopathic type of management, and second is with the Ayurveda. So we have prescribed this Arogyavardhini 4 tablet 3 times in a day, high dose. I know. Kumari number 8, 4 teaspoon with equal amount of water, and Abhayarishta 4 teaspoon with equal amount 2 times after meals. So this gives the instant benefit to the jaundice patient. Within 1 week, the patient regain his appetite and bilirubin levels immediately comes down within only 1 week. That is a very creditable with compared to the modern side, because allopathic treatment, there is only a supplementary treatment like B complex, vitamin C, saline, and antiemetic, and bed rest is most important. Of course, bed rest is necessary for Ayurveda also. But compared to the modern treatment, Ayurvedic treatment gets a better results. Okay. Next, we will discuss another prescription for jaundice. Here is Arkalu Ayurved Aushadhi Seva Sangha Nashik, 1 tablet, 3 tablets 4 times in a day. Then Jondex from Sandu Company, liquid 3 tablespoons with equal amount of water 2 times in a day. Next prescription, my dear friends, for the infective hepatitis or jaundice, Suvarna Suta Shekhar, 60 milligram, Lakshmi Vilas, Lakshmi Narayan Ras, 120 milligram, Praval Basma 120, Arogyavardhini, best liver tonic, don't forget it, 250 milligram, 3 times in a day. My dear friends, we are discussing the jaundice, infective hepatitis. Here also you can use the Rohita Karishta, especially in addition to that, what you can say, the splenomegaly, because hepatomegaly and splenomegaly, Rohita Karishta is the best medicine. 4 teaspoons with equal amount of water 2 times after meals. Liu 52 tablet, very popular. Himalaya company, 2 tablets 3 times in a day. And Punarnava Mandur, when there is anemia or edema also there, this Punarnava is helping for the diuretic and anti-edema, and Mandur Basma is very good for the hematinic, improving your hemoglobin. 2 tablets 3 times in a day. But in addition to that, you have to do the boiled and filter water for drinking, strict bed rest, stay away from the spicy, oily, sour thing, and one is important, avoid the fatty food. Next, we will discuss about fever due to amoebic hepatitis, Arogyavardhini tablet, 2 tablets 3 times in a day, Rasaparpati 250 milligram, plus what is that? Kuda Ghana. Kuda is a anti-Holarina dysenterica. This is a plant. Kuda Ghana 125 milligram, Praval Bhasma 250 milligram, Gulvela Sattva, Guduchi or the Giloy 250 milligram. All this mixture should be given 3 times in a day. Then in the amoeba, take care of the water, boiled water for drinking, for cooling. After cooling it, of course, fresh sweet buttermilk and Musta Kshirapak. Musta or the Nagarmutha is Amapachak #1 medicine. Okay, stay away from spicy, oily, and sour things. Now we will discuss about the typhoid fever. This is the first prescription, my dear friends. Lakshmi Narayan Ras, 2 tablets 3 times in a day. Laghu Malini Vasant, 2 tablets 3 times in a day. Amruta Arishta 4 teaspoons with equal amount of water, and Tiktaka Ghrita, because the long run fever, whenever there is a long duration fever, Ayurveda always recommends the medicated ghee or medicated milk, because there is a debility of all the tissues, all the dhatus. Tiktaka Ghrita 2 teaspoons with warm water 2 times in a day. Next prescription for the typhoid fever. This is another second prescription. Lakshmi Narayan Ras, 2 tablets 3 times in a day. Rasaparpati 125 milligram. Then Mrugashrunga Bhasma 500 milligram. Sitoparadi Churna 1 gram. Praval Bhasma 300 milligram 3 times in a day. Here you can add that Kasturi Bhairava Rasa Baidyanath 1 tablet 2 times in a day with honey. In spite of that, if you don't want that mixture, then you can advise the Kasturi Bhairava Rasa. This is alternative for this formulation. Remember this. Next, here again another prescription you can make by this another taking this tablet separately. For example, here you can see Kasturi Bhairava Rasa 1 tablet 2 times in a day with honey. Then Jayamangala Ras Suvarna Yukta Baidyanath Company 1 tablet 3 times in a day. Guduchi or the Gulvel Sattva, all this with the honey. Then Satatta Jwarari tablet 4 teaspoon or liquid 4 teaspoon with equal amount of water 2 times in a day, and Godanti Mishran 2 tablet 3 times in a day. Now we will go further, that is the infectious fevers. So what you can give the prescription for infectious fever? Madhumalini Vasanta 2 tablet 3 times in a day. Chandrakala Rasa, 2 tablets 3 times in a day. Sutta Shekhara Rasa, 2 tablets 3 times in a day. Then Parpatadi Kwath, 4 teaspoons with equal amount of water. And Paripathadi Kadha, Ayurveda Seva Sangha Nashik, 4 teaspoons with equal amount of water. Now we are discussing the fever due to the malaria. So this is the first prescription. Lakshmi Narayan Ras, 2 tablets 3 times in a day. Jvarankush Ras, Hariparshuram Aushadale, pharmacy from the late Khadiwale Vaidya from Pune city, Maharashtra state, 2 tablets 3 times in a day. Saptaparna Ghana tablet or powder, 125 milligram plus Daru Haridra Ghana, 125 milligram 4 times in a day. We are talking about malaria. Okay. Shita Purva Jwara in Ayurveda. This is the second prescription. Parijata Guti, very specific for malaria, 2 tablets 3 times in a day. Patoladi Kwath, 4 teaspoons with equal amount of water. Then Maha Sudarshana Churna or tablet, 1 teaspoon 3 times in a day with warm water. My dear friends, we are discussing about malaria, fever with rigor. Okay. And periodically, every day once or every alternate day or every after 2 days, that is typical periodicity is there, and fever with rigor, always malaria suspicious is there. And the modern doctors, they prescribe the Risochin tablet. This is the Sanshamani Vati from Guduchi, 200 to 500 milligram 2 times in a day with honey. Then Chaturthika Jwarari tablets. Chaturthika Jwarari, 4 teaspoons with equal amount of water. Then Sattata Jwarari tablet, 1 liquid, 4 teaspoons with equal amount of water. Santata Jwarari, 4 teaspoons with equal amount of water. You can give the liquids in this way, 1 or 2 or 3 all. Then here Jwara Shudahara Rasa, Baidyanath Company, 1 tablet 2 times in a day, or Chirakin tablet from Jhandu Company, 2 tablets 3 times in a day. Now we will discuss about the urinary bladder infection, urinary bladder, pyelitis. Chandraprabha tablet 3 times in a day, 2 tablets 3 times in a day. Punarnava Ghana is a diuretic, 250 milligram plus Gokshura Churna 250 milligram 3 times in a day with rice water. This is also has a, what you can say, the alkalizer, because it will reduce the acidity of the urine. Then Varunadi Kadha, 4 teaspoons with equal amount of water 2 times in a day, especially when there is a calculus or urinary stone. Bangashil tablet from Allersin, 2 tablets 3 times in a day. Next, we will go for fever due to meningitis. I have already said, please call 108 ambulance and refer to the patient to the hospital. This is very, very serious disease. Pyrexia of unknown origin. When the fever is more than 3 weeks duration, you have the complicated cases and it must be better admitted in the hospital. But simultaneously, you must know what can be given in Ayurveda. Sanshamani Vati, very specific for PUO, 4 tablets 6 times in a day. Suvarnamalini Vasant, half tablet 2 to 3 times in a day. Then Alprasha from Allersin Company, 1 teaspoon 2 times in a day. Panchatikta Ghrita, I have always said, in a chronic fever, don't forget to give the medicated ghee or medicated milk after the 3 weeks. 2 teaspoons 2 times in a day with warm water. Now, hyperpyrexia. Whenever there is a tremendous high fever, 103 degrees Fahrenheit, then Godanti Basma, Pittagna treatment, Pitta Shamak, 2 tablets 3 times in a day. Chandraputi Pravala Basma, 2 tablets 3 times in a day. Mauktika Basma, Pearl, everything is very cooling effect. 1 tablet 3 times in a day. Then Chandrakalaras, 2 tablets 3 times in a day with Gulkand. Next prescription, what you can do in the high fever, sponging with the cold water or rose water, gentle massage with application, Chandan Bala Lakshadi Tel. Simultaneously, you can do externally. Then internally, also you are advised to give the Jahara Mora 500 milligram 2 times in a day with honey, Rasadi Rasa 2 tablets 3 times in a day with Dhanya Panchaka Kvat 4 teaspoons with equal amount of water, Lakshmi Narayana Ras 1 tablet 2 times in a day, Toxemia in fever, then Saubhagya Vati 1 tablet 3 times in a day you can prescribe. So my dear friends, in short, today, not in short, I know that is a very big lecture, but here we have covered the many important aspects of the fever. At least the people are understanding that when the fever comes, the doctor has to search for so many causes, especially I have mentioned the, I think 11 or the 12 important causes where I will end my lecture. You must not forget these 12 common causes of the fever seen in the general medical practice. Please see this. Number 1, commonest viral fever, then flu or the influenza is not viral. Influenza virus is a typical entity of the virus. Cold or upper respiratory tract infection, infective hepatitis means jaundice, pneumonia, pleurisy, amoebic hepatitis, meningitis, admit in the hospital, typhoid, second week diagnosis, infectious fever like chickenpox, measles, pilotis, malaria, and tuberculosis. My dear friend, this is all for today. And I request, although it is a lengthy video, but as everybody is interested to get the knowledge in depth, then this video must to see till the last end of the video. So thank you very much. Take care and see you in the next video. Please subscribe my YouTube channel. Although, but all the videos are not longer. Some videos are very short, like 5 minutes, 10 minutes videos are also there available on my channel. So don't get afraid that every video is lengthy. Thank you very much and keep support and help and your love and cooperation in the future also. Take care.